flag and a podium, and let's just hang out here today. It's a tremendous day for us to be celebrating some great work that's going on in the community, and I'm just thrilled to be a part of it from my side, from the federal government. My name's Lloyd Longfield. I'm Member of Parliament in Guelph, and just welcome to everyone that have been working in this space and how to help people get to a better pathway. Before we get started, just to acknowledge that we are on the traditional lands of the Mississaugas of the Credit, the Anishinaabe, Haudenosaunee people, where Indigenous people traditionally have done wraparound support of people in their community. And the mental health and addictions piece is also something that shows the Indigenous approach to supporting people in the community, making sure that everyone is looked after and everyone needs the respect and gratitude that they deserve. I'd like to thank Stonehenge for opening the doors here again today. It's great to be back, and thank you to all of you that have joined us. I know that all of us that are working in the area of supporting healthcare, housing, supporting pathways forward to people in different ways, it really takes a community, and it's great to have the community here, including Guelph Police Services and the work that they do as well. We look at, I've been reflecting this morning about, the issues around housing. I was talking to a constituent yesterday, and she was concerned about housing, and I was sharing the concern, but also saying we have to look at the reasons for homelessness, in particular that part of the housing continuum of shelters and getting into temporary and then hopefully permanent accommodation, and the role that substance abuse plays in putting people into the situation where they are facing homelessness. We do need to build more homes, but we also have to have other solutions to help people going forward. So that's something that our government is trying to work on from the federal side, and of course working with provincial partners and the municipal partners and the community groups, the not-for-profits, the charities, people that are looking at this tragic overdose crisis that our community's facing here and across the country. Since 2016, more than 36,000 people have died of an overdose in Canada. And according to the most recent national data, there were approximately 20 opioid toxicity deaths per day in 2022. The opioid crisis is widespread, it's pervasive, it's devastating families and devastating communities, large and small. It used to be a downtown problem, but now it's a problem that every community in Canada is looking at. How do we handle this? How do we wrap our arms around the problem? We know that it's affecting our community and those who have lost a loved one or are personally affected. Later this month, we're going to be marking Drug Poisoning Awareness Day. We'll have an opportunity to honor and remember those that we've lost this year. We continue to raise awareness to stop the stigma and to work to create better care and supports. And today, it's all about continuing to fund those working to do just that in Guelph and our surrounding areas. With stakes this high, we need to do everything in our power to protect those at risk. And it starts with preventing overdoses, but it doesn't stop there. We've embraced a comprehensive approach, one that includes improving access to health and social supports, as well as treatment programs. And talking to Mike about the treatment program, the peer support groups, and how that's an innovation that we're doing in our community to make sure that people have the conversations and are listened to when they're at the emergency room and looking at what's next. So today I'm announcing the funding of more than $1.8 million of additional funding for the 3 projects here in Guelph. The projects that will help improve the health outcomes for people living with addiction and those at risk of substance-related harms. The funding is going to help the Guelph Community Health Centre to increase their capacity and its current Safer Supply program while providing supports for participants such as prescription access and access to primary and specialty care services, income housing, and nutrition. Stonehenge will be using their funding to provide peer-led and low-barrier support response for people in Guelph and Wellington counties struggling with substance use. And finally, we're also supporting Wyndham House to provide our youth with better access to housing, education, and financial supports in Guelph, Wellington, and Dufferin counties. I can't overstate how important this all is, that we need to continue the support and investing in community-led organizations. You all know our community, and you know the needs of Guelph and Wellington and Dufferin. I'm proud to be here as part of the government that shares the life-saving work you'll continue to do with this funding. So because of today's investment, this is part of a broader commitment to making quality treatment, prevention, and harm reduction services more accessible to everyone who needs them. And it's going to do lots of good things, as it has been doing over the last few years. We're going to continue to work together closely. That's not an option. In Guelph, that's what you do. And we all do it together. So combining the community engagement with the support from the federal government and our partners, we need to help people to get to the point of long, healthy lives. And enough about me and our funding. I'd love to hear from the people that are actually doing the work, starting with Kristin Kerr from Stonehenge to say a few words.
Good morning, everyone, and welcome to Stonehenge, and thank you for being here today as we celebrate these exciting funding announcements for our community. As a non-profit addiction treatment provider, Stonehenge offers a variety of services, including a 42-bed long-term residential treatment program and a range of community-based services along the harm reduction continuum, including supportive housing, addiction medicine and withdrawal services, and community and justice programs. At Stonehenge, we envision a community in which people who use substances are welcomed, supported, and thriving. The funding being announced today will help us to achieve this vision by supporting the ongoing operations of our peer-to-peer overdose response program, which is entirely led by individuals who have lived experience with substance use. These peer recovery coaches provide a support like no other, as they have a unique capacity to support individuals who are stigmatized because of their own experiences with substance use. I have had the privilege of watching peers in action as they support others, and it is truly remarkable to see what they are able to do and what's possible with this unique way that they can support those who are in need. Stonehenge highly values the role of peers and the voice of lived experience across all of our programs, as they help to reduce stigma and the harms related to substance use. The peer-to-peer program that we are here to talk about today partners with the Guelph General Hospital, as well as other community partners, and has been greatly supported by the Wellington Guelph Drug Strategy to ensure that individuals who experience a drug poisoning and their loved ones have the support they need in the moment that they need it, to feel supported, to navigate the health system, and to figure out next steps. This funding from the Government of Canada highlights the importance of continuing to enhance the capacity of community mental health and addiction services, which means bringing care closer to the people who, where and when they need it, and also helping to ease the burden of emergency room visits. I am so grateful for the amazing collaboration between service providers across our Guelph and Wellington County communities, as we help to provide a system of care for those who are experiencing harms relating to substance use. Thank you to the Government of Canada for your continued investment in addressing the opioid crisis, reducing stigma, and saving lives. Thank you. I'd like to invite Lindsey from the Guelph Community Health Centre to say a few words.
Good morning. I will echo what has already been said. It's amazing to see the support of so many community partners here as we celebrate this announcement. As Kristin shared, I'm here today on behalf of the Guelph Community Health Centre. I'm the manager of our harm reduction services at the CHC, and so I have the great privilege of working closely with our teams that deliver these services in our community on the daily. What does this funding announcement mean for us? With this continuation, Guelph CHC and our partners partners will be able to continue to extend these much needed services and wraparound care to our clients to address other health and social issues. And we know that this need now is greater than ever. Safer supply is but one more harm reduction tool that allows medical professionals to prescribe opioids and to reduce or eliminate a client's reliance or an individual's reliance on the illicit street supply. And as I said, we know now more than ever the need for this exists in all communities and particularly in our community here in Guelph. This program is saving lives in our community, and this continuation will ensure that we are able to continue to do this important, meaningful, life-changing work in our community. Safer supply is but one more tool in our toolbox for managing the fatal overdose epidemic that is ravaging our community. Thank you again to our community partners for your support of this work, and thank you again to the Government of Canada for your support of this continuation.
Good morning. Thank you to Lloyd Longfield and Stonehenge for hosting this event. It brings me great pleasure to accept the additional Health Canada Substance Use and Addictions program funding on behalf of Wyndham House. We too often are hearing about the tragic results of substance use in our community. Specifically for Wyndham House, we see firsthand how devastating substance use on the individual, their loved ones, friends, support agencies, and our community. Substance use and addiction is a community emergency, and this funding goes directly to address the emergency and support those most in need. The SUAP funding has proven to be highly successful for the concurrent hub at Wyndham House. This hub provides wraparound services to local youth to address their needs and help them to a path that avoids entering the adult homelessness system. The hub provides youth access to social workers, counselors, physicians, nurses, and other support workers. The hub meets and addresses the needs of the youth at the moment at the moment that they need it, and for the reasons presented. It helps to alter their social determinants of health and set them on a path to success. Since opening the concurrent hub, we have seen a significant reduction in both chronically homeless youth and those presenting with concurrent needs. Since receiving the SUAP funding, Wyndham House has provided service to over 300 unique individuals in this community, and the additional funding will allow us to serve even more youth and keep our hub open until March of 2024. The hub has allowed Wyndham House to complete over 100 assessments and provide ongoing psychiatric appointments. There have been over 100 concurrent treatment appointments provided by the different clinicians at the hub. We've been able to reduce hospital visits by way of providing access to nurses and physicians, and that's been about approximately 150 appointments. And over 50% of the individuals who access shelter at Wyndham House in the past year have been referred to the concurrent hub and started care within 2 weeks of that referral. These achievements are astounding given the current client and shortage of resources across our community. As the president of the board of Wyndham House, I applaud Wyndham House staff and acknowledge the dedication and hard work they have put forward in developing and implementing the concurrent hub. I also want to applaud the community and our partners who work alongside us, like Stonehenge and Guelph Community Health Centre. Their commitment and unwavering determination has broken down many barriers our community is facing. Together, we are making Guelph and the surrounding area safer, healthier, and stronger. The SUAP funding will allow us to continue to work towards these goals. In closing, as the only concurrent youth-focused program in Guelph and Wellington, Wyndham House is pleased and thank you for the influx of funding as it will continue to support our work in preventing, supporting, and addressing youth homelessness through assessment, treatment, and support. I encourage individuals who have the ability to make decisions around funding to continue to consider youth in our community, as this is an area that we can make a big difference for our community today and our population in the future. Specifically, thank you, Lloyd, for all of the advocacy that you have done for our community and the federal government for the support. Thank you, everyone.
Thanks, Rita. Thank you, Rita, and thank you, Lindsey and Kristin. We're opening up for questions, and I'm glad to have some technical support on this. So if we've got any questions from the media.
I'll go. This is kind of more technical than political. But I know there was an alert last week or the week before about, I think it was purple fentanyl causing like over a dozen overdoses. The thing that stood out to me wasn't the alert itself, but that it was kind of like one of the few times we've gotten an alert like that this year. Is that an indication that maybe some of those pandemic issues with the illicit supply are maybe clearing up, and that, or maybe that this is working, these programs like SUAP are working?
Mainly from the political side, that we have invested in the borders to try and stop the supply from China and the United States and other countries. We've put money into the Guns and Gangs program to try and stop the internal movement of drugs within communities. We look for indicators that these programs are working. I would hope that would be an indicator, but I don't have the details myself. Maybe one of you folks or someone else in the community that might have the details.
I can speak to your question.
Sure.
You're absolutely correct. There was an alert that was issued in our community on August 11th. At that time, we had had approximately 17 overdoses in the preceding 2 weeks. And as well, we lost 4 community members in that same time period. And so we felt that an alert at that time was warranted, and that is something that many of the community partners who are here today are involved in making that determination. What we continue to see is that the toxic drug supply is ever evolving, and so we don't know, and that's why. And I mean, this is why we're here today, right? Because we know that having a safer alternative to that street supply is needed now more than ever. And so we will continue to monitor that data that is specific to our community to determine if more alerts are needed, and we'll issue them as needed. In the meantime, we know that we need to do everything we can in order to provide alternatives that are going to be harm reduction focused for our community members.
I had questions, but you're with a camera, and I'd like to come a little closer to actually hear you. Does anyone mind if we sort of move in and scrum more so than? Does anyone have an issue with that? Okay. Adam, I'm in your way, am I?
No, I'll move.
Get the close up.
Get the close up,
Get in
that's
here.
right.
You guys can move in too. Maybe you can hear the scrum. Yeah.
So, Lloyd, 1.8 million is that enough?
Enough would be measured by results, and we know that there's still a great need out there, and we know it's a complex need. So this isn't all the money that needs to go into fighting it, and it's not the only program that needs to be used to fight the opioid crisis. But it has been quite effective in our community, and that's why it's being continued.
As in your time as MP, what have you heard? What has changed when it comes to this crisis?
The illegal movement of drugs, in particular from low-cost countries like China, has been really stepped up over the last few years. And the mental health piece through COVID has really affected people negatively. And whether it's through their conversations online and social media and the hate that's online is another area that needs to be addressed. People are in a bad spot in terms of mental health, and self-medicating using illegal drugs that are not safe is a problem that all communities are facing. So from our side, we're trying to work the different avenues, whether it's through the justice system, through the illegal movement of drugs, to the borders that need to be more secure, to the data that we need to trace the effects on communities to see that we're heading in the right direction. But homelessness is one of the ones that you don't necessarily make a connection to, but we've seen an increase in homelessness, which is quite often a symptom of what we're seeing through mental health and then addictions.
And sorry, you guys jump in if you want, but I'm just gonna go. When you talk about your side of things, meaning the federal government, When I hear people talk about this crisis, they say we need treatment. Is there anything the federal government can do for more treatment options, beds, getting people into rehab as well?
Yeah, the massive infusion of federal money into the healthcare system across Canada is to help provinces with and territories with their delivery mechanisms, including the hospital beds, but also the family health teams, the doctors, the nurses that are needed. Then the provinces have to come back to the federal government to say, here's our new plan. We know that what we've been working over years has not been working in this crisis, so this is a new way that we're going to be using the money that we're getting from the federal government. So there's an accountability piece that we're building in. We're providing resources and sometimes guidelines, but really it has to be a solution that comes through communities, through the province to the federal government. So, and it's not to pass the buck. Constitutionally, healthcare and education are provincial responsibilities, so we do what we can to support the provincial governments and territories, but also the not-for-profits and the charities, which, you know, yesterday we had some funding going out to Red Cross, the United Way, and community foundations locally, which also have programs that are helping. There's about $2 million in funding that we announced yesterday on that as well. So.
And you've announced you won't run in the next federal election. So in the weeks, months, however long until that election happens, what is your message in regards to the opioid crisis here in Guelph to your colleagues in Ottawa?
I think we all have time frames or time constraints on us. I put mine into writing to say I've given my 2 years notice, which what kind of job do you give 2 years notice? But and I'm seeing Rita here. Before I was a politician, we worked on the situation table together, an incident table, looking at helping people that were vulnerable in our communities. The work will have to continue, and I hope to be a part of that work in some way or another. But I think in terms of Ottawa, the clock is ticking on all of us, and the communities are becoming more stressed because the crisis continues and people want to see it over. So thanks to the groups that are here supporting us to do the work that has to be done, and we provide what we can in terms of resources for ourselves.
I'm done.
And if elected, no.
I just want to direct my question towards you folks. How do you sort of talk to those who may be misinformed, don't quite understand the stigma, they don't quite understand safe supply, and how this money is going to be helpful? How do you address those folks?
I think it's important to know that there is not a one-size-fits-all for substance use treatment. To your question earlier, treatment isn't just bed-based services. The services we are providing and that are being funded here today are treatment for substance use issues. So I think it's important for people to know there's a continuum of services out there for a reason, because there isn't one option that would work for everybody. As with any health issue, there's more than one treatment option that can be needed and is required. So I think it's important for people to recognize that when they're thinking about the variety of services that are in the community.
And do you think maybe numbers or just things off the top of your head that would provide that showing what the work you're doing is working and helping to kind of help those folks who are in that
Yeah, I think for all of us, there's some data we could get to you about that in follow-up. Absolutely.
Okay, awesome. Thank you.
And Lindsey, can you, first of all, can you spell your first name?
Yes. L-I-N-G-S-E-Y. My last name is S-O-D-T-E.
And what is your title?
Harm Reduction Manager.
And are all of you, what are your pronouns, just so I can double check?
She, her. She, her.
Lloyd is. Excellent. Safe Supply, the program in Guelph, I've heard some criticisms of it that, you know, people get the drugs through the program and then are able to actually turn it around and resell it. Is that something you're hearing through the program and from people you're helping? And if so, is that how the program is supposed to work?
I can't speak to that particular feedback, but what I can tell you is that we do have rigorous practices in place that we are consistently reviewing and assessing to ensure that we do everything we can to manage any concerns about diversion. And certainly we welcome that feedback from the community. We are always an open door in terms of hearing from our community if there are concerns or they'd like to
people that see safety supply and see it as just you're giving people drugs, what is your response to them when they say that?
I think Kristin said it best when she referenced that we're talking about needing a spectrum of addiction services here, and as unique as every individual is, so too is going to be their customized plan. We are working closely with the folks in our program to support them with where they're at, and we'll continue to do so.
And you go ahead. Sorry.
Well, the question I was kind of raising, this kind of sheds the light on that incident out in Toronto where a woman got shot outside of a community health center. Are you worried that some as more as it's coming attract some say bad people to the neighborhood?
I can't comment on what would happen when it happens in other communities at other sites where services are offered. Only at the Guelph Community Health Centre what our approach is. And again, we work closely with our partners and with our service providers to ensure that we are doing everything we can to mitigate any concerns that come up in our community.
Or would it be safe to say that hasn't happened? You haven't had any such incidents?
That would be correct.
What is the importance of you folks working together and communicating with each other, and what does that look like, and how does that work? I don't think we can undervalue how important that is and how great of a job our Guelph and Wellington County community does of working together. The folks that we are supporting have a lot of complex needs, and to Lloyd's point, following the pandemic, the volume of people who need support and the complexity and severity of their need has really increased. And so folks need more than one kind of service. There isn't any one of our organizations who can fully support one human. And so our working together is what makes sure that people get the supports they need when they need them.
And not in the room, Canadian Mental Health Association, the work they're doing with the integrated youth mental health supports. The University of Guelph has opened up a center for youth mental health. So this is a very important snapshot of the support groups, but
there's definitely more.
There's
Many of whom are standing behind you
Yeah.
just now.
Yeah.
Following up on that, though, I mean, you go downtown, in the dark corners, there's somebody sitting alone, somebody using. They aren't in a place to come and get these supports yet. So I guess how do you close that gap? And all this funding is great, but it's for people who are ready to start going down the path of treatment. What about the people who aren't yet? How do we reach them?
The by name list is one major tool that we have, and Wellington County is working with the individuals in the corner as you're describing them to make sure we know their name is known and why they're there, where they came from, what their needs are. So Wellington County then works with the other support groups in Guelph to make sure people get to the right place.
Rita, I was hoping, thinking ahead to next week with Overdose Awareness Day on next Thursday, I think the Guelph release said it's drug poisoning day. Mm-hmm. And I wanted you to expand a little bit on the importance of addressing this in youth, in particular, because you mentioned that during your, I don't want to call it speech, but during your comments.
Yeah.
As you reflect on that day and what youth are facing right now, we know that mental health is a huge issue for young people and that substances might be something they turn to. What do the young people in the community need to know, or either who are using or who know people who maybe have started using, about where they can go if they are seeking help?
So I think the important message that we need to get out there is that there is help out there. There's many doors that they can go to, and so any door is the right door, and whichever door they feel is the most comfortable. As community partners working together, we will help navigate the system to get them to the door that's going to do the best for them. I also want to comment on the fact that youth are an interesting but also important population to really keep in mind, because their trajectory can change so easily with the right implementation of supports. And so this is a population that, for all intents and purposes, on the surface looks like they're going down a really bad path, but with minimal interventions and the right supports, we can change that path and really change the direction. And I would encourage you to speak to anyone who works at Wyndham House to talk about some of the youth that they have seen come in a really bad way and leave and be really stellar community members and give back to the community what they've learned through the supports that they've received with the services in our community.
And I know it's next week, but maybe I could get each of you to sort of reflect on what next Thursday does mean for you. To have an overdose awareness day, to have that day to remind people that this is happening in our community, because some people will turn a blind eye to it when they're downtown or elsewhere, as we've said, like it's throughout the community. Rita, I'll start.
So I'm gonna start with, we talk about the downtown, the most visible population, but we have people who use substances all the time across all walks of life, and I challenge anyone that's here today or listening to this to really think about, do I not know anyone? Because every one of us is touched by substance use. We may not have been touched by drug poisoning, and please, I hope no one does, but we have all been touched in some way, shape, or form by substance use. And to understand, people don't choose. Don't wake up in the morning to say, I'm going to go do this because this is going to be the fun thing to do today. There are reasons people are on that path, and we need to be supportive, empathetic, and willing to support them, because there are ways to get them help, and there are ways to help them have better outcomes in their life.
Lindsay? Yeah. Drug Poisoning Awareness Day is an opportunity not only to continue to keep this conversation at the forefront, it's also a day for us to acknowledge and recognize those community members who we have lost, and that there are names and faces and stories behind those numbers. And so it's now more than ever, it's important that that conversation continues, and that we are recognizing the unprecedented loss that our community is experiencing.
In addition to Drug Poisoning Awareness Day next Thursday, this Thursday in Mount Forest, there is also a Drug Poisoning Awareness Day, so just wanted to highlight that as well, as it's important that for our folks who are up in Wellington County, they have the same opportunity that we're talking about here, to really take a moment to recognize and be together, to feel the impact of all of the loss that our communities have experienced in this past year.
As someone who works in this field, though, like, what do you feel on that day? Is it just another day for you?
Heavens no. No, it's such a powerful event. Last year was the first one in the county. It was really wonderful to be able to bring that. The Wellington Guelph Drug Strategy has worked to bring that there. And it's such a powerful time to be around other folks who have experienced these losses, but also for those of us who work closely with those folks, to be there for one another as well.
Well, thank you.
Sorry.
Just one more
One more,
question.
it's very short. Has the language changed? So does overdose mean drug poisoning? Are we using that as the term, or are they two separate? Just to clarify.
And what are your recommendations?
Yeah. In terms of the language,
Yeah, there is a shift happening, a really important shift happening, because I think based on the toxic drug supply that is in our community, there are a number of people out there who are using substances and they don't know what are in them. And so they have been poisoned by a substance that they didn't need to take. That's a really different implication than someone who has overdosed or taken too much of something. Most of the time, someone is experiencing a drug poisoning. And so we really are working to make a shift with that language to help destigmatize what's happening to members in our community.
Thank you. Appreciate that very much.
Great question.
Well, thank you. Thank you for the media for showing up and covering the story and getting the word out to our community. Thank you to our wonderful partners, good friends that are working in this area, and for all of you that have shown the interest to come out. So we'll keep working together.
Indeed.
No, standing still is not an option. Thanks, everyone.
Thank you very much. Thank you.